So Fairhaven is privileged to host everyone here today. This health center is the medical home to over 32,000 patients, and we employ over 250 staff. And because of your efforts with the Earned Income Tax Credit Enhancement Program, many of our patients and staff are going to benefit, and that's a good thing. So, and as inflation, I think we're all acutely feeling the impact of inflation, and as inflation significantly impacts all of us, and with not a clear end in sight, this is a gift that is very welcome, and I'm here to extend our big thank you to all of you for pushing this through. I just want to take 2 minutes to remind us all that there are a lot of inequities throughout the state and the country, and they're particularly stark in this community in Fairhaven. I'd like to share a few sobering statistics. So among the roughly 32,000 unique patients we served in 2021, 62% live below the federal poverty level, and over 90% live below twice the federal poverty level. I think we can all agree that those numbers are sobering. For individuals making a bit more and paying federal income tax, especially those with children, this earned income tax credit enhancement may well mean more food on the table, warmer clothes in the winter, and I could go on, but I think we all can get the point. This sort of unencumbered funds for our working poor families will make a big difference in the lives of many in this community, so we're very grateful for that. I want to learn more about this. I'll be very honest. I went through it and I wanted to understand it, so I'm eager to hear from you who created this, and so I can understand better how it's working. And I want you again, once more, to share this good news and to hear from us, all of us here, the impact that your efforts are going to have on our patients and our staff. So thank you so much.
Pleasure to be here at Fairhaven Community Center. My name is Mark Bowden. I'm Commissioner of the Department of Revenue Services, and I'm honored to be with Senator Lewin and Representative Walker to talk a little bit about the Earned Income Tax Credit. And I also have Deputy Commissioner Biello with me, who handles a lot of the operational day-to-day management of DRS, because I also spend time building bridges and roads here in Fairhaven for the Senator and for the Representative. I think you'll find it fascinating how quickly we can mobilize and distribute checks to our residents. But you know, people I think have a misconception of this program. Sometimes they perceive it as a handout, and it's really not a handout. The operative word in the entire EITC program is earned. This is an earned income tax credit. You have to work to be eligible for this credit. And in a state where we have over 100,000 job openings right now, we want to encourage people to go back in the workforce, particularly after COVID, because it's been such a difficult time for us in being able to do that. So we're excited from the DRS side to participate in this program. We're thankful to the legislature for appropriating the money in this year's budget. Remember that this year's program has been expanded by presidents from both sides of the aisle, from Ronald Reagan to Barack Obama at the federal level. And we go off the federal queue in terms of the mirror what happens at the federal level. So there's a wide bipartisan agreement that this really is the way to incentivize and help families at the same time. In 2022, there are 28 states, including the District of Columbia as well, that offer a state EITC. Missouri, Utah, Washington were recent states that just adopted it recently. The great thing about EITC is that it's refundable, it's a credit, it exceeds the state's income tax liability, the taxpayer's liability, excuse me, and it can help offset other costs for that family, things like food, things like supplies for school, things like housing costs, which we were talking about earlier, about how difficult it is right now for our residents. So this program has and will continue to uplift families out of poverty. Over 5 million families across this country have been lifted out of poverty because of this program. And while these checks going out aren't a cajillion dollars per family, there are some very, very small and some very, very large. Commissioner Biello will talk about that at the end. The reality is that people will open up their mailbox in the next week and find a surprise, something they didn't feel that was coming, and be able to use that for things in their family that they need. Now look, these programs don't happen in a vacuum. They happen because of our governor, Governor Lamont, who supports this program. Governor Malloy did as well. And it happens because of our great legislators, 2 of them of which are here today. but really the father of the EITC in Connecticut is Senator Looney. And he really rolled this out many years prior to 2011. And at that time, I was mayor of Danbury, and I wasn't really sure about it. I didn't know how it worked. I'm like, I don't know, this sounds like a handout. But I started listening to him and listening to several discussions that he gave over the years and became a true believer, in particular in the EITC program. So, Senator Looney, I want to thank you for your leadership and caring for families, not just here in New Haven, but across Connecticut, and saying, we know you need a hand up. We're here to do that with you while you work, and we're going to encourage you to go back into the workforce as well. What vision, what courage, and what determination in getting this done. And so without further ado, I want to ask Senator Looney to come forward and speak.
Thank you so much, Commissioner. The Commissioner and I served together in the General Assembly for a while. He was a state representative from Danbury before he was mayor for many years. And I want to thank Dr. Lagarde for hosting us here today. As we all know, the Fairhaven Community Health Center does extraordinary work in this community and is a lifeline for so many people who otherwise would not be able to secure health care at all. A large number of patients here have no health insurance at all, and this is truly a beacon of hope for them, as community health centers all over the country are. We thought it was appropriate to have this announcement here today. The Commissioner asked me to select a location in New Haven. Since probably a very large percentage of the people who are patients here at Fairhaven are EITC eligible, I figured it was a natural fit. And the Earned Income Tax Credit was first established at the federal level during the Ford administration in a bipartisan effort. And what it does is create a refundable credit for low-income people, and our state credit is pegged to a percentage of the federal credit. So ours was established in 2011 at 30%. It has fluctuated a little bit since then. We got it back above 30% in 2021. But now Governor Juan has supported adding to that with the federal ARPA fund, so that now it is going to be above 40%. So that supplementary payment is going to be sent out, as the Commissioner said, in the coming week, and it's going to be substantial. But what the EITC does is rewards work. It recognizes that there are people who are working full-time, sometimes in multiple jobs, a week in several part-time jobs sometimes, trying to just piece together a minimal living. And what the EITC does is provide a supplement to that, both at the federal and the state level. And it really is an economic stimulator, because for low-income families, virtually every dollar that comes in goes out again. They're not in a position to be able to save or build up a nest egg for future purposes. They are living paycheck to paycheck. So that anything that helps that and provides a little bit of relief of the pressure they're under on a weekly basis is extraordinary. So it means that they'll be able to pay for food, and we know the cost of food has been rising. They'll be able to pay for clothing and supplies that they need to go to work with. They'll be able to pay for a repair on the car that they need to go to work with, or for other transportation that they need. So everything that comes in goes out again. So it really is an economic stimulator. And again, it's critically important in this area, because New Haven obviously has a significant low-income population. There are almost 12,000 households in New Haven that benefit from the EITC, and over 3,000 in Hamden, which is the other part of my district. So it really is focused not only though on the cities, although they are the largest percentage of recipients come from the larger and needier cities, but there's every single community in the state has at least some EITC recipients. Even some of the wealthiest communities all have at least some. But New Haven with 12,000 is a very substantial number. So the extra money that's going to be coming in is going to be a significant economic stimulus for people in New Haven and in Hamden as well. So I'm very pleased to be here with the Commissioner, with Representative Walker, who is our chair of the Appropriations Committee, who does so much as a champion for social service spending. And again, thanks so much to Dr. Lagarde for hosting us here today. Thanks so much.